Hello, and welcome to Deep, the health marketing podcast. I'm your host, John Mangano. We're kicking off season 2 with a renewed focus on one of the most important challenges in healthcare today, reaching underserved patient populations. There are whole populations in the US that don't have the same access to healthcare providers, the same access to healthcare facilities, or even simply the same access to the healthcare information that patients use to make decisions. Without that access, they're also left out of the data that the industry uses to study healthcare trends, which in turn reduces these populations' access even more. So today, we'll explore how smarter strategies, deeper empathy, and how more inclusive thinking can help us connect with all patients, including those who have historically been overlooked. And there's no better person in the industry to discuss that with than Holly Dunn, managing partner at Havas Media Network. Holly brings both personal passion and professional insight to this challenge. And we're going to talk about everything from health deserts and underinsured populations to how to incorporate these populations in outcomes driven planning and measurement. Welcome, Holly.
Thanks, John. Really excited to be here today.
As you know, this show is all about people, whether the patients, or providers, or ourselves as health marketers. So tell us a little bit about yourself. You have an interesting family situation. You have twins at home, I understand.
Yeah, for sure. I have three kids. Two of them are twins, which they just finished their freshman year in college. And I have a younger one who's still in high school. All three of them are athletes, which definitely keeps us busy. Pretty much every weekend, you can find us either on a field somewhere, a tournament, traveling around the country. Um, the family dynamic also connects to my work in interesting ways. As someone in our age demographic, I'm dealing with both children that I'm responsible for and for aging parents, which gives me a very personal understanding of the different healthcare challenges across different generations.
Yeah, it's an interesting thing. No one ever tells you about this stage in life where you're parenting your kids who believe they're adults and don't want to hear what you have to say, or at least mine. And then you're parenting your parents who think they're your parents and are, should be telling you how to live life, but ultimately they depend on you in various ways. My 95-year-old mother is in rural Texas. My brother is physically there taking care of her, but I'm always there trying to help, and it's so hard. Do you have that dynamic too?
Yeah, for sure. Actually, you and I now have a lot more in common because my parents are also in Texas. Obviously the distance really makes it challenging. Up until a couple of years ago, they lived 20 minutes away from me. Now that they're, hours away on a plane ride, it's really, really challenging to be, supportive of them and also balance everything in daily life.
At Havas, there's an increased focus specifically on uh, underrepresented populations. Tell us more about the project.
Yeah, so we actually have been focused on what we call meaningful media for many years, and we have developed a few marketplaces that really address meaningful media and bring to life the content and data alignment across different industries. About a year ago, we decided that there is a gap in the healthcare marketplace around equity, and we decided to develop the health equity marketplace along with DeepIntent, which represents the healthcare industry's first dedicated solution for addressing health disparities through targeted advertising. This is really a groundbreaking opportunity, and we're really excited about it.
And, I think that is a great segue into this conversation because, I mean, when we think about underrepresented populations, I think we have a narrow definition of what that may be. I think it's broader. There's a lot of populations that are underrepresented. So, when I think about it, obviously there are ethnic groups that are underrepresented. Certainly, I work with a lot of data, and that data, is only as good as what is reported. And really, a lot of that comes from insurance and other things. And there are populations without insurance. But there's more to that, right? There's geography. What are the populations that you think people don't realize are underreported that really should get more attention?
Yeah, I think like as we've explored this project, every time we have a conversation with somebody about like what they consider to be, equity in healthcare, there's a new topic that comes up, which I think is also really exciting about this project. Obviously, we already touched on the insurance issue and whether it is, underinsured populations or people with like supplemental insurance gaps. The cultural nuances of it. Location is a big issue, right? I don't think that living in like the Northeast, we're probably not as aware, but there are huge health deserts in this country where people don't have the opportunity to access healthcare like we do. The local hospital might be more than an hour away from them, which, when you're thinking about maternal care, can have huge implications. Obviously, we touched on the aging population. I think another issue that comes up a lot that is probably not talked about as much is the policy application of it, like what's going on in the political landscape that's impacting healthcare and accessibility.
And I think that's an interesting point because if we're not really focused on it, if we're not looking at it, not by design, but simply by happenstance, there are pockets that are missed. So without having that kind of a focus, we are, ultimately creating these disparities unknowingly. And certainly, I don't think anyone in the industry wants to. It's just happening that way because there are a lot of disparities that we may not be aware of, whether it's based off of the geography or other pieces. So let's walk through some of those different types of disparities. First, you had mentioned health deserts. Let's talk about health deserts. Give me some examples.
Yeah, so health deserts are typically defined as people who live in areas where they have limited access geography to healthcare. And that could be anything from a pharmacy to a healthcare clinic to a hospital. And this can obviously impact the users, a patient's ability to get healthcare when they need it most. I think one of the examples that I always bring to mind, because I think it's probably the most prevalent and most talked about, is the maternal health care system, and the number of women in this country who live outside of an hour radius to a hospital, which can severely impact their maternal health when giving birth. If they can't get to a hospital during that process, it really has an impact on the health of not only the mother but the patient, the baby.
And beyond that, I think it's an hour for someone who is maybe, we all have busy lives. So working 40, maybe more hours a week, taking care of multiple kids, even parents, doing the things that we all do. We're all very busy. I had a doctor's appointment this morning. It was 10 minutes from my house. I ran in, I did my thing, I got back, and my life went on. If I had to take 3, 4 hours to visit my doctor, I don't know if I would go. And in this particular instance, it's my dermatologist. I'm a redhead. I've got to, I've grown up in the sun. I've got to make sure I don't, have certain things going on with my skin that could take my life. Right. But I don't know if I would go as frequently if it was half a day's commitment. And I think that's material.
100%. And I think when you layer in the things of, when people need to visit doctors or out care clinics like regularly, patients who are on dialysis, patients who need infusions, things that require them to be in a clinical setting and they don't have access to that, really puts a strain not only on them personally, but on the entire healthcare system.
Definitely. And, where are health deserts? If you're thinking of the US, what are some of the obvious health deserts and less obvious ones?
Yeah, that's a great question. I think, obviously, when you look at less populated areas of the country, whether it be, the Midwest, the Northwest, or even areas that are geographically inaccessible, people who live in the mountains and have to travel out of the mountain down a winding road to a healthcare clinic, that might mileage wise not be 100 miles, but it might take them, 2 or 3 hours to make that journey. That areas like Texas, where you have dense population areas, but then some of the more rural parts are obviously less accessible.
And, accessibility for me, who's relatively healthy, is very different than my 95-year-old mother who, up until not too long ago was still driving. But the idea of her going more than 20 minutes is the equivalent of me probably going 5 hours for treatment. So the condition of patients also makes a difference. Someone who is treating cancer, making that hour trek is probably asking a lot more than it might be for the rest of us.
Right, and 100%, and when you look at the aging population, they're also less accessible to, like, driving, right? They're not driving themselves as much, then they need another mode of transportation to also access that healthcare. I think those are the transportation issues that also line into this marketplace too, and how we're thinking about how can we, support these patients and give them messaging and also, help them overcome some of these challenges.
So, other underserved populations, I think probably most people think of cultural groups that might treat healthcare differently or need special language support. What are some of the examples that come to mind there?
Yeah, those are both 2 great examples. One is, language barriers to healthcare and also having, communication issues between health even if you are there and you don't speak the language, being able to have, someone to translate or a physician or clinician that is going to help overcome those language barriers, but also how, different cultures, approach their healthcare too in terms of, like, their decision making, right? Whether it be, more family driven conversation, but also like caregiver approach.
Mhm.
I think those are all different nuances that we need to take into account when we're having these conversations.
Definitely. And you mentioned government policy, and that's something I didn't really think of. Tell me more about government policy and how the political landscape might impact healthcare access.
This is always a tricky conversation, right? How to have these conversations without making them political. And that's why I try and just think about them in general terms of, things like vaccinations, right? If we're changing government guidelines on what vaccine policy is, that changes the way that the insurance companies cover vaccinations, and it changes the way what vaccines will be covered for different populations, whether it be, children, aging adults, females, maternal care. And then that also then has trickle down effect into the supply chain. If an insurance company isn't covering it, doctors aren't going to stock it as much. And then pharmaceutical companies aren't going to manufacture as much. So even if you want to get a vaccine, if the guidance doesn't cover you, you might have a hard time getting it.
Yeah, even where you go might change from where we have gone to where we might go. My wife's Canadian, and I found it really bizarre when I found out that to get certain vaccines, you actually go to the drugstore, you pick it up, and then you take it to your healthcare provider, who then would give it to you, which is very strange to me because it's not my system. But by the same token, um, it works, it's fine. But if we start changing like that, if it changed here like that, I think a lot of us would be delayed in, just figuring that out and managing to it. And so, like, even just how we deliver and the mechanisms of, not the delivery as we call it for like the injection, but the actual distribution and process of that starts to change. We all need to adapt, and ultimately, it doesn't make things necessarily faster at first. It only slows things down.
100%. And I think that, in some areas, things like telemedicine have helped overcome certain gaps. But, to your point, when you're talking a vaccine, that a vaccine can't be delivered via telemedicine. And you still have to like go to somewhere where you can obtain the vaccine, whether it's a pharmacy or a clinic.
So you mentioned telemedicine, and so telemedicine and remote medicine kind of can work together more. The nice thing of telemedicine is that it is much more common, and I think we all kind of feel more comfortable with it. But it can only go so far. And I'm reminded of a surgeon who was a researcher in Antarctica who ultimately had to give herself a mastectomy because of ultimately she couldn't leave. It was winter and she was not going anywhere for a period of time, which is mind blowing. The bravery that she had, but by the same token, how do we manage remote medicine and even telemedicine today to be able to support care that could help us access these unaccessible populations?
Yeah, I mean, I think that's a great thing. Obviously, like insurance companies and providers are more engaged with telemedicine now than they have ever been before. I think like in the mail every week I get from our insurance company a reminder like, don't forget, you can, schedule this via your telemedicine call or get this support via an app. But again, I'm reminded that we tend to live in, a kind of bubble of A, technological adoption, but B, also, pretty stable Wi-Fi, and that not every part of the country has that ability. So while telemedicine might be a solution for some, it might also be a hurdle for others.
Are there any solutions to solve for that, where in rural environments there might be kind of better Wi-Fi, better connectivity, so that it becomes a hub? Or what have you seen anything in industry to help resolve for that?
Yeah, I've seen brands try and address and overcome some of the gaps in care, and whether it's, mobile clinics for vaccinations that are actually going to, underserved areas or more rural populations to bring, like, the vaccine to them. We've also seen some companies like do this like with infusion centers and, pop-up clinics and those kind of things. So I think those are opportunities to help, reach some of these, but it's also how do you make the populations aware of those offerings so that they know that it's there for them. And I think that's one of the things that we're hoping that the marketplace that we've developed with Deep Intent will help us overcome, because it'll really help us focus in on those people who need the care when it matters most and help make them aware of these opportunities more readily.
So you and Havas have recognized how important this is. How, as an industry, are we doing today, and where do you think we can do better? And what would that impact be? Sorry for the three levels of question, but I think this is just so important and so fascinating. The degree to which Havas is leaning in on this important topic.
Yeah, I think people have good intentions, and I think it's time to align those intentions with actions. I think that sometimes we tend to not focus on the things that matter most or need the most attention. And obviously, like, some of these things aren't. I think health equity is something that's being spoken about more now as more awareness comes to play, and the political conversations and the climate of what's going on in the country have brought some of it into the limelight. But I think we still need to continue to find different ways to address this and make sure that the people who matter most aren't getting lost in the noise.
Oh, and I love the focus that you all are placing on it. I've worked with every agency and every brand in the industry, and every one of them ultimately wants to focus on making patients better. We all agree on positive outcomes, and maximizing how we can do that. But I don't know that everyone understands that even though you might maximize the degree your campaign may deliver on that goal, that it may be maximized, but it only may be maximized in a defined population that is not all of the population. And I think your recognition of that is commendable. I think the industry with more awareness would all agree that, yeah, that's exactly what we're doing, but they're probably not focused at the degree you are. And I think that makes a big difference. How has the industry responded to this project?
We've had a ton of response to this project, and all positive. We've had people reaching out wanting to get involved, offering new ideas and thinking about it. Like I mentioned, like, there's been opportunities that have come up that we weren't even thinking about when we launched this project. How to activate things like creators in this space, and use the power of social to also amplify the precision of this offering. So I think, we're definitely continuing to evolve it. I think the more that we talk about it, the more opportunity we see to enrich the marketplace with either more content or more data, and really amplify its impact.
We've talked a lot about the patients who are having accessibility challenges, but a large part of what we do in pharma is focus to the providers who are ultimately working with those patients. And it all kind of intertwines in the end, but as we market, we tend to separate them out. So when we're looking at marketing to HCPs, how do you see is the most effective way to focus on HCPs to reach these underserved populations?
That's a great question. I think it's one that we haven't explored a ton yet. However, we've given some initial thoughts to it. Obviously, the campaigns that we run are both focused on patients and providers. the provider aspect of it, because it's more easy to identify providers based upon like their MPI numbers and the targeting that we have against them, we've given some thought to being able to overlay that with either uh, like script level data to identify, patients that might be on a regular infusion, or patients who are on regular like vaccination protocols, and really help to bring together those physicians that are on the fringes of what we would call health deserts to enable them to reach out and provide offerings, whether it's copay messaging. Like I mentioned, there's the mobile clinics that we've seen a couple of clients engage in. Really to push out those communications to patients as well, because it's something that's affecting everybody, and the physicians are on the front line, as well as I think the other thing is that taking it beyond the physician to the entire care team, right? Like the nurses and office staff in physicians' offices play a huge part in enabling that care.
And a lot of healthcare is community, right? And so there's geography, of course, right, where communities are just not served. And then there's also, as you know, you'd mentioned earlier, the cultural aspect. And in many cases, the targeting and understanding that maybe certain cultural groups are less likely to go to the doctor or more likely to listen to uh, a doctor who is more like them, helps us to then maybe recognize and start building and targeting. So, we've all managed to a target list, but that target list, as we start to recognize underserved populations, maybe there becomes not just underserved populations of patients, but also a focus on the healthcare providers specifically who work with them. I know a lot of the time it's a function of we don't have data because maybe they're underinsured or they're more of a cash based culture, and so those doctors don't necessarily have the kind of data on them that they're even treating the conditions. So maybe there's a way we can focus not just on those patients, but specifically on the HCPs serving those patients.
Yeah, and I think that's a great point, and I think that that's also an area of opportunity where we haven't really explored from the marketplace yet perspective, but I think from the entire pharmaceutical landscape, we do talk about, right, like point of care is a huge part of um, our offering, and it's an opportunity to get in the room with the provider, with the patient, and how we approach point of care, and how we're providing different versions of things in language and cultural and education materials that really can like serve all the patient's needs and be flexible. I think right now we have so much opportunity with technology and AI to really be more thoughtful and curated in our approach and the content that we're providing than we have been historically, and really have that impact where it matters most.
So let's say you have a new client who comes to you and is excited to reach underserved communities, but has feels like they've not done anything to date. What three things would you recommend they start with?
That's a great question. I think first I would, really reassure them that nobody's not done anything, right? Like pharmaceutical companies have copay programs. They do have things that are in place to help serve these populations and fill in some of the gaps today. I think that where maybe we've not done a great job is getting that into the right person's hands at the right moment. And I think that the three things that this approach helps us is one, with the technology and the precision, right? We have the capability to reach those populations now, with intentionality, not accidentally, right? It's not part of a larger program. We have the ability to really be very targeted and very specific to the people who really need to hear the message. And then the second, right, it's about intent. It's about people being healthy, people living longer. It's not about checking a box on a form that, yes, we're doing a diversity program. It's really helping people live longer lives, and how we can help, enable that and make it easier for companies to participate in this. And then the third thing I think is the cultural competency, right? We need to understand and like embrace and support how different communities make healthcare decisions, and how brands should be adapting their approach accordingly. I think technology, AI, things like dynamic content are really going to power this approach, knowing that the message itself has to be given and delivered specifically to the audience so that it'll resonate.
So how are we doing as an industry? If you were to give pharma a scorecard, do we have a lot of room to improve in, or have we maximized uh, our efforts in reaching underserved populations?
I think that's a great question, and I think that we're at the beginning, right? I think people are starting to recognize it. It's being talked about more. People are starting to recognize that the cost of inaction is enormous, that healthcare disparities hurt the entire healthcare system economically. I think that brands need to stop treating it as a nice to have and start treating it as an essential part of their strategy and have it actually be a strategy that they take. Um, I think that we also need to keep talking about it. Opportunities like this, even if it's, just a podcast or an article or us talking about it at an industry event, there's so much more that we can do to talk about underrepresented populations and where we're moving as an industry, and ad tech supporting that industry is critical.
I mean, when you think of marketing, we're pretty new to the whole marketing game compared to CPG or really anything else, right? We've been doing it, I don't know, since the 90s, arguably 2000s at any kind of scale. Um, so I think as an industry, we kind of our adolescents at best. And now we've figured out how to make marketing work, and by work, ultimately help patients get well. And we have plenty of studies that prove pharma marketing helps improve patient outcomes. But now I think, and it's only because we've never actually focused on the micro segments within the population. We focused on how do we make diabetics, better, whatever that definition is, right? Now it is, well, there's 60 million diabetics. Are we making all of them better? And I think that's where it's more out of, I don't want to say ignorance, but more out of lack of awareness, that having these conversations, and the more we all talk about it, the more we become aware that everyone should be getting healthcare and access, and marketing is one of the ways we can do that.
I agree 100% with everything that you just said.
So, what would the next steps be for us as an industry?
I think keep talking about it. I think the more that we can talk about it and the more that we can use technology to solve problems and bring people together and bring patients opportunities to overcome, the health challenges that they're facing, the better off we'll be. And then I think the more that, we expand on our offering and when we get learnings from it, sharing results and sharing the ideas, because it's just going to be a benefit for all of us.
So, for our listeners, what would be the three key takeaways that you'd like them to remember about advancing health equity across our industry?
Yeah, so I think that the first one would be, like I've said, keep talking about it, keep asking questions, keep thinking. I think the more we can innovate and the more opportunities that are out there that we're talking about, the more movement that we'll make towards, advancing this industry. And then I think it's about being authentic, right? Not just checking a box saying that yes, we have a diversity program, or we're really, focused on health equity. It's about truly finding solutions that enable people to be healthy, happy, and live ultimately longer lives. And then I think along the lines of authentic is making sure that you're doing it in an authentic manner and an authentic voice, and recognize that we have the ability to power to save lives. I think this is truly one of like the few industries that in advertising that where we can talk about where we truly are making a difference in someone's life.
Yeah, and wherever we are, like as a population, the healthier we all are, the better it is for all of us. Whether it's communicable diseases or just general health uh, items like diabetes and other things. It is, when it's all said and done, better for the population as a whole, whether it's economically or socially or emotionally, when we're all well. Because we are, when it's all said and done, whether it's a small community or the community of the country, we all ultimately impact each other, whether it's obvious or not.
Agree with that 100%. And I think that the other important piece to keep in mind is that the cost of inaction is enormous, right? The healthcare disparities in the system hurt the entire healthcare system, not just the individuals that are facing it because of costs and infrastructure and, policy.
Yeah, and when the healthcare system is expensive, in its entirety, healthcare is expensive, which also affects all of us. So, in conclusion, if you were to have access to the younger version of you who's just starting your career, who's interested in this topic, what advice would you give them?
Ooh, that's a good question. I would tell them to keep focused on what matters, right? I think sometimes we get lost in the overwhelming, especially in our jobs, overwhelming amount of data and partners and opportunities that sometimes we tend to lose sight of, what we're really trying to do at the end of the day. I like to say sometimes, like, you know, this is not advertising is not life or death, but when it comes to healthcare, it is. And I think it's something that's hugely important to the world that we live in today. There's so many different things impacting people's health that I would tell my younger self to keep focused on doing good and being better, and try not to get caught up in the day-to-day ups and downs.
Well, thank you very much for joining us today.
Thank you for having me. This is a great conversation. I really appreciate it.
This has been Deep.